Sometimes during a home birth, things can go wrong and a baby can suffer an HIE brain injury. To be clear, this video, we're going to be talking about specifically cases where the injury happened during the home birth and not at the hospital. When this happens, the questions quickly move from what caused the injury to what does this mean for my child's future and what legal options do we have? This video is a follow-up to a previous video in which I discussed topics that families should think about when they are contemplating whether a home birth is going to be something that is going to be good and safe for them. As a birth injury lawyer, I hear stories from families all across the United States, and when I review these cases, I have to look at the medical facts and also the practical realities. In a hospital setting, doctors and nurses, they have access to electronic fetal heart monitoring, emergency medications, and the ability to perform a C-section quickly if that's needed. At home, those tools are just not there, and if problems arise, delay in transferring to a hospital can make the difference between a baby that is going to be healthy and a baby with permanent brain injury and brain damage like HIE. HIE can develop in these situations for a number of reasons: a prolonged labor, an umbilical cord problem, or a drop in the baby's oxygen can all lead to a brain injury. If a transfer to a hospital is delayed, these precious minutes of oxygen loss can leave long-lasting damages. And these are some of the medical realities that come up when I review home birth cases. Another important piece is understanding the legal duty of care. In hospitals, doctors and nurses have both a clear duty of care to the mother and to the baby. They are legally required to respond to complications and to act according to medical standards. At a home birth, the picture can be different. If a licensed midwife is present, there may be a duty of care, but it can vary by state. If only a doula is present, many may have no medical training and they're not considered medical providers. So often there will be no legally recognized duty of care. Families need to know who is actually responsible for the medical decisions and the interventions before complications occur. But here's another hard reality that comes up with all of this. Many families do not know it until it's too late. And when a baby is injured at home, there's often little to no insurance coverage available to pursue a case. Without insurance, it can be impossible to move forward when the injury is severe. I've had to have hard conversations with families and explain that although I believe that something went wrong, there is simply no way to recover the money that's going to be needed for their child's care. I've seen cases where there simply was just no insurance to move forward with things. These are some very difficult conversations to have, and when I have to have them with what I do, it can be extremely heartbreaking. The costs that come with raising a child with an HIE brain injury are not small. Depending on the severity of the injury, life care, economic plans, they can project needs into the millions of dollars. And that's just not just medical equipment. That could be therapies, that could be adaptive equipment, that could be in-home assistance, and sometimes it can even include modifications to the family's home or modifications to a vehicle. These are the real needs and they require real resources to be done. Even if you're not planning a home birth and you're considering a birthing center instead, these are some of the same questions about duty of care and about insurance coverage that you should still be asking. Some families tell me that when they bring up questions about insurance or malpractice coverage, the staff or the providers, they seem shocked or even kind of dismissive because they're asking that question. That reaction can feel intimidating, but it does not mean that you are wrong to ask that. Knowing who is legally and financially responsible if a serious event or a serious injury happens is important. It's an important step that you can take for your baby's safety. Some centers, they will carry insurance and they may have licensed providers, but others may not. So asking about licensing, training, and medical malpractice coverage, that can be essential to all of this. I share this information not to create fear in you, but to help families understand the realities before they are faced with an emergency. When things go wrong, the clock is ticking and families are left questioning, all of these types of things, and it can last a lifetime, these types of questions. So if you're watching this video and you're thinking about these issues, or if you have a friend or family member who is considering a home birth, please share this video with them. It could help them ask the right questions and be better prepared for what comes ahead for them. Again, I'm Marcus Boston, and if you have any other questions about your baby's HIE brain injury at birth or subsequent CP diagnosis from a medical legal standpoint, don't hesitate to reach out and contact me. You can find out more information about me in my profile. My information is there. If you're watching this video on certain apps, you can send me a DM and we can chat a little bit about your baby story, or you can just wait and watch the picture that follows the end of this video. All right, that's going to be it for this morning's quick educational video. Have a great weekend, everybody.